Hi, everyone. I'm Kelly O'Horo, and this is Adaptable, Behavior Explained. Hi, everybody. Welcome to Adaptable. Today, we're going to talk about a pretty common symptomology or disorder called ADD or ADHD. And we're going to explore the nuanced view of ADD and ADHD, understanding them not just as a biological occurrence, but also as a potential symptom of trauma. We'll discuss various treatment options, including natural interventions, as well as effective behavioral interventions and therapeutic approaches, such as EMDR therapy. If you like this episode and want to hear more about this topic, make sure that you like it or share it with someone who could benefit. And don't forget to subscribe so that you don't miss any future shows. So according to the DSM, that's the Diagnostic and Statistical Manual, this is where therapists and mental health professionals diagnose other disorders. Basically, ADD is characterized by a persistent pattern of inattention and or hyperactivity or impulsivity. And it has to interfere with functioning or development. And so I'm going to read you the criteria for the diagnosis so that you can kind of decide according to this if you may or may not fit the criteria. So inattention often fails to give close attention to details or makes careless mistakes, has difficulty sustaining attention in tasks or play activities, does not seem to listen when spoken to directly, does not follow through on instructions and fails to finish schoolwork or other duties, has difficulty organizing tasks and activities, avoids or is reluctant to engage in tasks that require sustained mental effort or are boring, loses things necessary for tasks and activities, is easily distracted by extraneous stimuli, is forgetful in daily activities. So the hyperactivity and impulsivity side of things, these people might fidget with or tap their hands or their feet or squirm in their seat. Runs about or climbs in a situation where it's not necessarily appropriate, and is unable to play or engage in leisure activities quietly. They may seem like they're on the go, acting as if they're driven by a motor. Perhaps they talk excessively, blurt out answers before a question has been completed, has difficulty waiting their turn, interrupts or intrudes on others. So for a diagnosis of ADHD, several symptoms must have been present before the age of 12 years old, and they have to be present in two or more settings, like at home, at school, or at work, and interfere with or reduce the quality of school, social, or work functioning. Symptoms should not be better explained by another mental disorder in order to rule out something else. So studies indicate that traumatic experience, especially in early childhood, can predict ADHD symptoms. So attention deficit disorder, or ADD, and ADHD are often discussed in the context of biology and genetics. However, there's a growing body of research that suggests a link between ADHD and of trauma. So trauma can alter the brain's architecture, changes the brain, and potentially it can intensify the symptoms of ADHD. Now, it doesn't mean that trauma causes ADHD, but it can exacerbate or contribute to the severity of symptoms. It's a complex interplay that requires a compassionate and comprehensive approach to treatment. And oftentimes, ADHD symptoms will mimic or look like anxiety symptoms. So it's important to also delineate between the two. So when it comes to treating ADD and ADHD, there's no one-size-fits-all solution, I'm afraid to say. Traditional methods include medications like stimulants or non-stimulants, as well as behavioral therapies. But I especially like Dr. Daniel Amen's approach from the Amen Clinic and how he talks about ADHD and ADD. He offers a really unique perspective that really resonates for me as a practitioner. And he emphasizes the importance of brain health and personalized treatment. According to Amen, ADHD and ADD is a neurodevelopmental disorder, and it can be influenced by genetics, birth conditions, environmental factors. But he also highlights the impact of various modern world influences that negatively affect brain function. Dr. Amen's approach includes using brain imaging technology to identify specific types of ADHD and ADD and tailors treatment accordingly. So he advocates for a combination of medication when necessary and natural strategies to optimize brain health. So these strategies include things like dietary changes, exercise, sleep improvement, and supplementation with several different kinds of supplements, but specifically omega-3 fatty acids and magnesium, as well as other specialized supplements. He has a company called Brain MD where he is very picky about the supplements and how he puts together combinations of things depending on the presentation of ADHD for people. I have a lot of respect for his work. So he also categorizes ADHD and ADD into 7 different types based on brain imaging findings. And I think he's up where over like 130,000 brain scans at this point. So he's got a lot of data to support the differences in these symptoms and target treatments according to what people need. His clinics offer a range of services and educational resources to help people with ADD and ADHD improve their brain health and manage their symptoms more effectively. But we want to also talk about behavioral interventions that are really a cornerstone in the management of ADHD and ADD symptoms. And these focus on modifying environments and behaviors to improve focus, organization, and impulse control. So here's some key behavioral strategies to keep in mind with ADHD. So first and foremost, when kids are little, parents need training. Parents can learn techniques to help their kids with ADHD. It includes things like establishing really specific routines, clear communication, preemptive communication, like letting our kids know, hey, we're going to go to the store in about 15 minutes, so I'm going to need you to clean up. And after the store, we're going to make 2 stops. So make sure you bring something to do in the car. Those types of communication will really help someone with ADHD manage the changes a little bit more effectively. But mostly consistent consequences for behaviors are really necessary with parenting. Classroom interventions might be needed as well for students. So teachers can use strategies like seating changes, breaks for movement, individual instruction. I know some teachers will put kids with the wiggles in the back of the classroom on like yoga balls so that they can move around more readily and not disrupt the other students. It's also really helpful as a teacher, as a former teacher. I would put children with ADHD near my proximity, and that way when I was going to move around the classroom, I could just gently put my hand on a shoulder, kind of cueing them that I'm right there with them, and that there's like a sort of a nonverbal cue about managing a little bit of a behavioral change that I would like to see without shaming the child and saying something. But individualized instruction often helps students with ADHD to stay engaged and to learn effectively as well, which makes it a little bit more work, but brains are fast and they need things to keep on coming. It's really important as we get older to have organizational skills training. So this involves teaching kids and adults with ADHD how to organize tasks, manage time effectively, utilize tools, things like planners, breaking down tasks into smaller steps, and setting reminders on things like our smartphones so that we don't forget the mundane, repetitive things that we have to take care of in our life. And there also might need to be some social skills training. ADHD can affect social interactions, and these skills and the training that can help people learn appropriate social behaviors and improve interactions with others, which helps to decrease feelings of being an outlier or rejection, which eventually can turn into things like depression. Stress management techniques are necessary. Things like relaxation techniques, mindfulness, meditation, and exercise can help us naturally address the stress and anxiety that's in our bodies when we have ADHD. And that energy oftentimes accompanies people with this symptomology. So these interventions can be tailored to an individual's needs and can be used in combination with medication and other treatments for a comprehensive approach to manage ADD and ADHD symptoms. It's important to work with a healthcare professional to determine the best strategies for each person because we're all different. So now we're going to talk about some therapeutic approaches that are gaining attention. CBT is one that has a lot of research behind additional assistance with managing ADD symptoms. But EMDR, or eye movement desensitization and reprocessing, was originally developed for PTSD, but it also has been shown a lot of potential in helping people with ADHD symptoms. Particularly when their symptoms are intertwined with traumatic experiences. And let's face it, oftentimes when we struggle with ADD or ADHD, we have traumatic experiences that accompany things that happen to us while we're growing up. If we always find ourselves with the wiggles or interrupting, people snap at us, people are intolerant of us. Maybe people don't want to be our friends. And so these sort of things can compile and turn into traumatic experiences that oftentimes accompany. So EMDR therapy uses bilateral stimulation to help the brain process and integrate traumatic memories, which sometimes lie at the root of ADHD or ADD symptoms. And while it's not a cure for ADHD, it can be a valuable part in a comprehensive treatment plan to help offer some relief and some new coping strategies for people who deal with this. So I want to talk about something that's a little bit harder to digest, and that's what happens when we don't treat ADD or ADHD in the long run, because it can have some pretty unfortunate consequences. If we don't help kids with this, it can lead to a range of challenges and risks throughout their lives. So some potential consequences of untreated ADHD during childhood can be academic difficulties where people struggle to pay attention in class. It leads to poor grades, falling behind, a lot of shame accompanied with that. Social challenges, people may struggle with controlling emotions, and behavior can result in social problems like troublemaking or keeping friends. It can be a big contributor to low self-esteem because children with untreated ADHD also experience low self-esteem or depression because, like I said before, they might be criticized or picked on regularly for some of their behaviors. There can be increased injuries. So there's evidence suggesting that people with ADD untreated might have more accidents and emergency room visits because of impulsive choices. As teenagers, they can continue the academic struggles and may continue to perform poorly in school, and then perhaps be less likely to catch up on academics requirements. They will likely engage in more risky behaviors because there's an increased desire to engage in dangerous behaviors like substance abuse, risky sexual choices, eating disorders, particularly among girls. So we want to help them regulate their nervous system through a variety of these different things that I'm talking about today. There can be issues with driving. So teens with untreated ADD are more likely to have difficulties with driving and may be involved in more car accidents because of the impulse control or the inattention issues. As adults, there could be employment issues, facing unemployment or employment challenges, including difficulty maintaining a job or staying organized enough for job requirements that are needed. There can be relationship struggles because it can lead to ongoing relationship difficulties, emotional dysregulation, and conflicts. So we really want to address the symptoms that come with this. It's important to seek professional guidance for a comprehensive treatment plan that can help to mitigate these risks. And recognizing that all of us are different, we all have a different history and different resources and different accommodations that can be made. So we need to be open to and flexible with an assortment of potential treatments when we're looking at this. So as we wrap up today's episode, it's clear that ADD and ADHD are multifaceted conditions that can be influenced by a variety of factors like trauma and other environmental experiences. Understanding this can open doors to more personalized and effective treatments, empowers people affected to lead more focused and fulfilling lives. I hope that you found this helpful today. And if you'd like to learn more, please check out some of the resources in our comments below. And until next time, make sure that you lead with love. It'll never steer you wrong.